Hi everyone, Jeffrey Schoaf here. I was recently asked about elbow pain, and believe me, I've certainly had plenty of my own throughout the years as a massage therapist and yoga therapist and teacher and a very active person in general. But I've got a couple of really easy techniques that are highly effective, at least they have been for me. If you go to a doctor with elbow pain, it's highly likely you're going to get diagnosed with tendonitis, tennis elbow, golfer's elbow, something like that. And certainly we feel a lot of pain in the elbow joint. That's often where it's really tender in our day-to-day activities, but oftentimes that is not where the pain is coming from. It's where we feel it, but it's coming from the muscles adjacent to the elbow. So they're coming from the muscles around the forearm, both outside and inside, and also from the triceps muscle above the elbow joint. So I'm going to show you these techniques. They're really simple, it's really effective, it's really affordable. All you need is a wall, your body, and a tennis ball. So I'm going to show you these things, and we'll talk about it as we go through them. So you want to come to stand on a wall, and you want to take one leg forward. If you know yoga, it's like a warrior stance. So the leg closest to the wall you would have forward, your other foot about 3 feet behind you, so that you can lunge easily forward and back. Now I'm doing grander movements than I'm going to do with the ball in a moment, but I just wanted to show you that technique. So you take the ball, pin it against the wall with your forearm. You're going to interlace your fingers, clasp your hands, and you're going to find little micro movements, rocking by lunging. So you're hinging at your hip joint to make the tiniest little movement as you find those trigger points, those tender points on those muscles of the outer forearm in this case. So these are called the extensors. So they extend the wrist. If you're in a push-up or plank pose, that's wrist extension. And you're just going to take about a minute to work that side, to work that point, and then you're going to go to another one, same thing, and work it again. Typically, much of the pain is going to be closer to the elbow joint, but often you'll find surprising tenderness further down. So that's the first one on the outside of the forearm. We're going to go to the inside of the forearm. You're going to stand with your back to the wall. You're going to pin the ball at the wall. Same thing again, and so you'll turn around. You're going to pin the ball there. You can clasp the wrist of the hand that you're working on, and you're simply going to do micro squats up and down. Really gentle, persistent, easy stuff, but you want to get in there and find that trigger point, hover around it, press on it, give it about a minute before moving on. Yeah, there's a good one right there. Thirdly, is for the tricep muscle, the muscle above the elbow. You'll need a table. I'm going to use my dining room table. Just sit in a chair near the edge of the table. Take the ball, put it on the tricep muscle just above the elbow joint. Interlace your fingers, clasp your hands, and gently press for about a minute. You can move up and down this tissue here, releasing all those trigger points. So the deal here is you're probably going to have to stay with this for a little while. If it's really acute, I'd recommend 2 or 3 times a day for 5 to 7 days. Could be longer, probably not a lot shorter. So it's just something that requires a lot of perseverance. And if you stick with it, you will get results, okay? Take care. See you next time.